Hi, everybody. It's Wednesday, December 30th, 2020. Surprise! I'm jumping in on Steve's Wednesday to record our last video for the year. Finally grateful to be able to say that 2020 is just about over and survive it well. We did. So we've been recording since, I can't remember, March.
Mid-March.
Mid-March, and have been able to say every week that we have no cases of COVID in our resident population. And so I know you're all curious to hear about the vaccines. Yesterday, we were able to vaccinate 100% of our residents in assisted living and the health center, which is a huge relief to everybody and just great news. They received the Pfizer vaccine with the help of our Walgreens team, and we were able to vaccinate just over 200 staff. Today we're finishing up the rest of our staff that are willing to receive the vaccine. I don't know the numbers of that yet, but I'll be able to talk about that when I do an update next week. We'll have the total number of staff that were willing to accept the vaccine. Walgreens will be back in January, and I'm hoping that more staff will accept it then. There is some vaccine hesitancy among the younger staff for sure, which all we can do is provide information and education about that and hope that they will accept it in the future. And so that's what we've been doing. Other than that, we will wait for public health to let us know when we have advanced to stage 1B. And when we advance to stage 1B as a state, they will allocate more vaccines to us for all of our independent living residents, which is tremendous news. I just don't know when that will be. It had been originally set up for next week, and they canceled that allocation because they did not receive it from the federal government. So we're really relying on the federal and state governments to talk to each other and then communicate with me via email. So as soon as I hear anything from anyone, I'll update you. And we'll get things scheduled. Now we know how to do it because we've done it 2 days in a row, and I think we have all the glitches worked out. And so we'll get a clinic set up as soon as we can, and we'll get everybody in quickly. I think we can get everybody done in 1 day once we have the vaccine on site and in our freezer. So that's my update on the vaccines. Let me know if you have any questions. Please reach out. And when I say all of our independent living residents, I mean everybody at any location and in the houses, and residents not in residence as well. So we've got you all covered. I just don't know when. Thanks.
Thanks, Kim.
Mm-hmm.
Just a couple of additional points related to the vaccine. So the Pfizer vaccine, there are 2 doses. They will be administered 3 weeks apart. So the second dose for the people who got them yesterday, that will be January 19th. The Moderna vaccine is a 4-week cycle. So the second dose for that, the people that are getting the vaccine today, will be on January 27th, if I'm thinking about that correctly. So just be aware, it's like that it is a two dose cycle to be fully vaccinated, and we do have plans for the follow-up for that second dose. And again, as Kim said, it's like everybody that we are aware of with our independent living population, whether you're living here or not, whether you've signed a life care contract and are not yet even moved into an apartment that you intend to occupy, you are on the list. We did receive a couple of questions from households who are on our wait list. And I'm not sure if any of our wait list households are watching these videos. But we will not receive allocations of vaccine for anybody who we do not have a contractual relationship with, a life care contract. Being on the wait list is kind of a beginning of a step in the door, but it is not a contract that you've actually committed to Oak Knoll, and we will not be able to get vaccine for households that are on the wait list. So I just want to make sure that people are aware of that. I did an update of our case count tracking yesterday, and we continue with a very, very slow downward trend of cases in Johnson County. As of yesterday, I think the average daily case count for the last 2 weeks was about 34. I believe the previous time that I recorded a couple of weeks ago, it was at 38. So it's decreasing, but very, very slowly. And the positivity rate in Johnson County is still between 7 and 8%. At that level of positivity, anything below 10%, we are still required by regulation to test our staff on a weekly basis. We will, for at least the couple of weeks following the holidays, continue to test more frequently than that. We're planning to continue with 3 times per week testing through at least the end of next week, just so that if anybody is newly positive, we're catching them as quickly as possible and preventing them from being here and potentially infecting anybody. So just quick updates on case counts and testing. We obviously have been doing this for almost 10 months now. 2020 is kind of a blur. For me personally, there's a lot of things that I'm missing. Hugs are one of them. I know for many of you, when we see each other in the hallway, that means a hug, and I am definitely missing your hugs and looking forward to them when it's safe for us. Sometime, hopefully by spring, we will be back in the hugging business again. Kim, what are you missing?
I'm definitely missing our parties and visiting with people without masks. So the vaccine is a very good thing, but we are not going to change any of our restrictions yet. I want to be very cautious, and I want to make sure that everyone in our bubble is protected before we do that. I see us making changes inside of Oak Knoll before anybody is making changes outside of Oak Knoll for sure. And I'm still looking very much forward to an end of the summer party outside, hopefully with family members and grandkids running around. And I just am really thinking about that party. But we need to be as cautious and careful as we've been for the past 10 months. And I know in March, some of you thought that Steve and I were nuts when we started to lock things down. And quite honestly, Steve may have thought I was nuts too. But we've proven over time that being cautious and being careful and paying attention paid off for all of us. And so I just don't want you to get your vaccine and rip your mask off and have a big party at Mixers. I want you to be careful. Keep all of your social distancing practices in place. We'll keep all the restrictions in the restaurants in place, and we'll slowly loosen things up. I don't believe we'll have coverage in Johnson County for quite a while. I think that Operation Warp Speed was not actually as warpy as they had intended. So until that speeds up a little bit, maybe with change in administration, maybe not. I don't know the inside information on that, but I'm fearful about the general population being able to get vaccinated. And so that's the outside of the bubble thing I'm considering next. So maybe once we're all vaccinated, about 2 weeks after the second vaccine for everybody in the building, we might consider loosening up our restrictions a little bit. So I'm looking forward to that. And I just want to thank everybody for all of your care and concern and consistency and trusting us to make some really heavy decisions this year. We just all kept each other safe, and I really appreciate that. And I appreciate you trusting that we weren't completely crazy, even though you might have thought we were, to keep everybody healthy. I mean, it's we don't know what's going on in other community living spaces, any other congregate living spaces, but there are outbreaks all around us. And what I took for granted in Johnson County with the other long-term care communities has disappeared in a matter of weeks. And there are outbreaks blocks away from here. And we have not had to experience that. And I'll be forever grateful for that, because it was the source of my nightmares, and that's over. so I don't have to have nightmares about that anymore. And that's because of all the work that we've all done together to keep each other safe and healthy. And I appreciate it. So 2020 for me will be a memory of caution, a tale of sticking together. And so I miss a lot of things, but I'll look fondly on 2020 as Oaknall being a strong community of togetherness and strength and character that I maybe took for granted before.
Yes, I think there's a lot of things that we took for granted that have been taken away from us this past year. And as they come back, I have a feeling that we won't take them for granted any longer. So wish you all the best. Happy New Year.
Happy New Year.
Take care.